At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live. This is yours truly, Dr. Tom, and we've got a great show for you as we always do. We're right here on WMAL 105.9 in the Washington metropolitan area. Those of you who are listening to us either on a stream version or someplace else, this is where we're located. So glad you're here. Glad you joined us. We're going to continue our conversation a little bit today on what happens when your gut is not working the way it's supposed to, but it becomes inflamed, and gut inflammation relative to pain that you don't know why it's there. Well, it can be that intestinal system of yours. And we've talked about constipation, and we've talked about diarrhea, we've talked about irritable bowel, we've talked about things like that. But I want to kind of put it together for you and let you know why, that inflammatory reaction that makes your hands hurt, that your elbows hurt, gives you that headache ongoing, never seems to go away. Your knees always hurt, your ankles swell up. It can be a direct result of the intestinal system. And I'm going to kind of put that together. But don't forget, on the 20th of August, coming up rapidly right now, on a Wednesday evening at the Roselle Center in Fairfax, Virginia, join us, Dr. Zhang, my traditional Chinese medical physician from Shanghai. Dr. Zhang has been with me about 8 years or so. Brilliant doctor. We're going to co-team and teach, and we're going to talk about this craziness called your intestinal system. So all you got to do to register, and we ask you to register, and you can go online at drtomroselle.com or rosellecare.com. And you'll scroll down, you'll see it, just push the button, register for the class. Or you can do it the old-fashioned way. Give us a call, 703-698-7117, 703-698-7117, and you'll be our guest that night. And we're going to have some fun, as we always do, and I'm going to do some demonstration. I'm going to show you what happens. I'm going to show you some points on your body that will show up when you're in trouble. But when that diarrhea of yours is not working the way it's supposed to, constipation can cause all kinds of problems, including, you see all the ads on television now for hemorrhoids, and, when they got all kinds of crazy positioning for that. But yeah, that's part of it. And when the system's not moving the way it's supposed to, and you just get that cramping and bloating, but the pain pattern, the pain that just comes about across the board is what we're going to talk about today. And I want you to join me immediately after this in the live stream. And we're going to be talking about migraine headaches as it relates to inflammation and your intestinal tract. But we'll kind of roll into that, and after we're done with this. But let's get into this, and let me tell you what really goes on. So your intestinal toxicity, that poison that's in your gut because of all the wonderful garbage that you've been putting in your system for so many years, can cause a tremendous amount of damage. And the inflammation, the inflammatory reaction, has huge effect on many different parts of your body. But intestinal inflammation, the number one thing that's going to have an impact on is your body's immune response. Now, when I say immune response, I'm not talking just about viruses and bacterial conditions and other things, but your immune response to injury and other irritation that's within that gastrointestinal system. Now, I'm going to go back again because I want you to get this. Now, your gut inflammation, inflammatory reaction. Remember my relationship, gut, acid, inflammation, so forth. All those things work together. But it affects your immune response to all kinds of things that happen in your body. And it can lead to symptoms that we've talked about, such as abdominal pain and bloating and changes in your bowel habits. Remember, we said either constipation, which is, if you go onto the website, that's what it's going to say. It's going to be constipation in your gut and so forth. But we're going to talk about all these things that you need to know about, particularly pain. Chronic inflammation can persist and affect all kinds of tissues in your body. Healthy tissues get broken down. Potentially, they lead to very serious conditions in the gut. It can go from that gut constipation. It could go to Crohn's disease. It can go to ulcerative colitis. There is an immune marker that we measure when we look at these types of conditions, some others, and it's called a gliadin IgA antibody. Now, your gliadin antibody also measures gluten sensitivities, and there's several different forms of gluten. But it tells us whether or not your system is potentially in problems just because of any kind of something that you put in your body. But the gut toxicity occurs when that lining in the intestinal tract becomes damaged. And here's what happens. Once it becomes irritated, once you got all this garbage in there, the things that irritated, the sugars, the sodas, the coffee, black teas, fast food, fried foods, alcohol, gluten, additives, my mantra, right? You've heard me say it 1,000 times. What happens is that the gut becomes permeable. That means that the gut lining, when it becomes damaged, allows bad stuff, harmful substances, bacterium, mold, fungus, viruses to enter the bloodstream. It can go in that way. And it triggers these inflammatory reactions, these painful skin problems and joint problems and fatigue, and even affects your mind. And it's come from your guts. If you're plugged up, or conversely, if you got an irritable gut and you're moving all the time, and you're exposed to this enterovirus that's out there right now, you're going to show up often with these problems, right? When a patient comes in and they have, all kinds of skin lesions and pimples and problems and rashes and so forth, and they go into the doctor and they got on this steroid and this immune suppressor. I said, your gut's a mess. He said, what do you mean is my gut's a mess? It's your intestinal tract that's not working the way it's supposed to. Your intestinal tract is polluted. So do I leave them like that, or do I tell them what they need to do about it? No, I tell them what they can do about it, and that's what we're going to do with you when you come and join us on the 20th. But you got to address these issues. So what would you do? Well, why don't you try something silly, right? Like change what you're putting in your mouth. Oh my God, vegetables I have to eat, or I have to eat clean meats. If you did something as simple as eliminate grains and dairy products and sugars, just that, no more than that, for 30 days, and eat some vegetables, eat a little bit of fresh organic fruit, a little bit. We're talking about berries and things like that, and try. You could do anything for 30 days. It's tough for the first 2-3 days, but you can do anything for 30 days. See what happens. See if your skin clears up. See if that brain fog goes away. See if that headache dumbs down. See if that joint space gets, much more flexible. And when you get up in the morning, you don't feel like somebody beats you to death. Those are all indicators that you may be suffering a problem. So if that's the case, we have to be able to make a decision, one, on your part. Two, if it's already affected your spine, it's affected your nervous system, it's affected your energetic platform of your body, those things have to be reset. They have to be helped along. But you know what the research shows? And here's the thing. In excess of 75 million Americans have some sort of digestive functional problem. That's 20, what is it, 4 times 8? That's 25% of us. And the GI tract is not only responsible for breaking things down, that's your gastrointestinal tract, that's your food tube, right? It's not only responsible for breaking things down, but it acts as a barrier, as we just talked about, and it regulates immunological responses. So if this thing is compromised, it sets off this inflammatory reaction that may go unnoticed until symptoms become severe or you're unwilling to put up with them anymore. It is amazing to me How many of you listening to me will put up with things for a long period of time until, you just can't do it anymore, or the drugs that you're taking are causing other severe symptoms because you think that it's, I can take a drug for this, a drug for that, a drug for that. Well, you bought into the pharmacopoeia model. That's what they want to do. They don't want to help you. They don't want to kill you. They want you in that place where they have to maintain you. Yeah, I said that. Understanding the connection between your intestinal system and inflammatory reactions is important for any doctor to really get if they're going to be able to help you. And it's not about putting the symptom out. It's about giving the patient the opportunity to be able to fix it permanently. I don't know about you, but when somebody tells me I got a problem, I say, I'm not taking that drug. I want to know how to fix it. And if you can't tell me how to fix it, I'm going to go find somebody that can tell me how to fix it. That's what we see in our practice all the time. People are fed up with what they've been told. They want to get off the junk all the time, and meaning the medication. So if you have this increased intestinal permeability, I give you a visual. You know what a colander is? Like you drain your pastas and your rices and so forth. You dump it in. If you've been cooking, you drain all the stuff out. Those holes are supposed to be in your intestinal tract, really, really tiny, to allow first digestion to take place, and then your body absorbs them slowly. But if they get larger, or if they change in their functional capacity, these little gut holes, if you will, become permeable, means that they absorb things faster and allows nutrients and beneficial substances to get into the bloodstream, but they're not linked. They're not, the term that we use is chelated, to be able to do something that they're supposed to be doing. And then when that gut barrier is not working, then all these other guys, these bacteria, toxins, mold, viruses, and so forth, they get into the system and they slip through, into that blood supply of yours. And now you got all kinds of symptoms that show up. So when this happens, it triggers this inflammation, this inflammatory response, and what happens, and that's the way the body tries to protect you. It tries to neutralize, right? It tries to neutralize what's going on. The problem is it doesn't stop, and it has its own damaging effect. So you have these inflammatory conditions like Crohn's disease and celiac disease and other immune disorders and so forth, that your physician is going to say, we can only maintain it, we can't fix it. Well, the truth of it is that your body can fix anything. And there's tons and tons and tons of data that supports what I just said to you. So if that's true, then you're the culprit that's standing in the way. Leaky gut problems are not universally recognized as a formal medical diagnosis. And yet the impact, the inflammatory response, the craziness is getting a lot of attention, right? Without answering the question, why is it there in the first place? They're just trying to suppress your body's own natural capacity to change something. And it's there for a reason. It's just not supposed to go on and on and on, because then it causes its own damage. So the key to managing chronic inflammation is getting at what's causing it. It's getting at the source. Fix that. So when we talk about, you've heard the term, and you've heard me mention it many times, microbiome. That's all your good guys and your bad guys in your intestinal tract. So we want a good microbiome. We don't want all the aberrations and the garbage that's in there and the bad bacteria and so forth. And it's a balancing act. It's a system, a universal mechanism, if you will, that has trillions of these little guys that are in there, and they regulate your immune system, and they protect you against all the bad stuff that comes into the gut. So, but when it doesn't work that way, when the harmful bacteria can grow and they begin to duplicate and they outcompete, if you will, we'll use that term, the good guys, it triggers the condition they call dysbiosis, and that just means the imbalance in this bacterium. And what can cause that? What triggers these things? It's like when you're always on an antibiotic, for anything, whether it's for your nose or your eyes or, You take it on topically, or you put it wherever you're going to put it, right? And it's ongoing. You continue to destroy your good microbiome, and subsequently you become much more predisposed to an inflammatory reaction. There's a lot of triggers to this. Stress. In today's world, I just had a conversation with my wife, and she's a great intellect. She's an amazing nutritionist, and Sue, is listening to too many of the talking heads these days. And I told her, I said, you got to calm it down. These guys are making you crazy, but it has an effect on every part of your system. Now, is there trouble out there? Yes. I told Sue, listen, we grew up in some of the most volatile times that this country's ever seen, in the late 50s going into the early 70s. The Vietnam years and the protests and the problems with segregation and so forth, they were bad. But she says, well, I was just oblivious. I said, no, you were busy getting an education. You weren't paying attention to it. You weren't involved in that type of thing. So it didn't bother you. I said, now you're focused. Every place we turn around, we've been listening to radio, we're on our live streams, our feeds, our televisions, and we're hearing all these crazy ongoing, inflammatory reactions that cause what? Stress patterns, which cause what? Pro-inflammatory reaction within our gut lining, and then further leads to intestinal breakdown. And a lot of you have very healthy abdominal big bellies. That's kind of in a cool way, right? Very healthy abdominal big bellies. But here's the deal with it. Sometimes you can't get rid of it. Why? Because you're all jacked up about stuff. And when that happens, cortisol goes through the ceiling. That's your protective mechanism that puts the fire out and helps your body protect itself. So the bacteria, the good guys that should be there, play an amazing role in producing something called short-chain fatty acids. One of the most prominent, and the one that they measure not only a percentage, but a total, is something called butyrate. And butyrate has a tremendous anti-inflammatory effect. But when we do a stool test, we measure the microbiome, sometimes we see that the butyrate level is low. People are putting up with all kinds of stressors. What are stressors? Well, we just talked about one. That's the emotional stressor, and that's profound. Two is what? Diet. All the garbage you've been eating. That stresses the body out. Two is pain that you're putting up with. Instead of fixing it, you can change things. There's a patient of mine, a very interesting gentleman, was a strong man for a lot of years. And, he's got very severe degenerative arthritis. And he came in and he was on a quad cane and walking very slowly and so forth. We started treating him with a lot of things that we normally do. One thing he had to do was change his dietary pattern. He started getting rid of the pain. He started getting better, but he refused to change his dietary pattern. And I would go to reflexes on his body. I said, this is bothering you. Your gut's bad. He says, well, how'd you know that? I said, simply because your body's telling me that through muscle function and so forth. I said, don't you want to get better? But sometimes we get caught and we get hypnotized into the advertising that's on TV. Here's this drug. It's going to do this, 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 and this, and it'll kill you as well, by the way. So go ask your doctor if it's right for you. I don't know about you, but when I was growing up in this country, they weren't advertising this stuff on television. Or, don't take it if you're allergic to it. How do you know you're allergic to it? Your doctor doesn't even know that you're allergic to it. But you may end up going in anaphylaxis if they give it to you. Do you want that, or do you want to change something and get that intestinal system to work the way it was meant to work? I would think, maybe I'm a little crazy, but I've been on the planet a long time now, that fixing something is much more supportive to optimizing and enjoying and appreciating your presence on this planet than going the other way. Well, on the 20th of this month, August the 20th, just a short few weeks from now, a couple weeks or so, Dr. Zhang and I are going to walk through this. And you know me, when I get a little emotional about stuff, I'm going to tell you the truth. But your intestinal tract is home to about 75 to 85% of your body's immune cells. Now, depending on the author, it can shift a little bit like that. And it's the central piece of the immune puzzle. If you want to increase your immunological response, you have to increase your gut microbiome. You have to protect it. When the gut is, that gut lining is being compromised, remember we talked about dysbiosis, leaky gut, again, just increased permeability. Your immune system is being constantly beat up and exposed to all kinds of negative junk, viruses, bacterium, and so forth. It enters there faster than it enters anyplace else. And if you're not digesting things properly, if you don't have enough hydrochloric acid in your system, if you don't have enough anti-inflammatory, what's one of the major anti-inflammatories? It's called DAO, right? It's called DAO. It's an enzyme. It's diaminase oxidase. It's a naturally producing substance that decreases inflammatory reactions within the system. And if that's not there, your system is going to go through the system ceiling inflammatory reaction, right? I'll tell you if your DAO level is low. Take your finger and scratch your skin with it. And if you get a big welt there, your DAO level is probably very low. And there's other things that are going to come about because of that. Now, here's the deal. When this immune system is activated and it's ongoing activating, it can damage all the tissue that's around it, right? And disrupts normal body function. The first is your gut. We talked about the diarrhea and the constipation. And remember, if you're not moving your bowels every day, cleanly, completely, and that feels good, right? Well, let me tell you something. You're constipated. You got a problem. And so when this occurs, it disrupts your body function across the board. Did you know that in your intestinal tract, that there's a reflex for every other part of your body? I bet you didn't know that. I'm going to point out some of those to you on the 20th. And so you can do your own monitoring. I'm going to tell you what to look for, how to realize that things may not be going the way it's supposed to. And then I'm going to ask you, you don't have to answer me, in public if you don't want to. I'm going to say, okay, how many of you want to do something about it? How many of you are willing to make some changes? How many of you want your life back? How many of you want to feel better? How many of you want to get your head working the way it's supposed to? Chronic inflammatory reactions that originate in the gut are constantly being linked to immune diseases, autoimmune conditions, metabolic problems, and your brain, my friend, mental health. If your gut's not working, you get a little crazy. I hate to tell you, but that's the way it is, and it's very, very recognizable in today's world. So here's the deal. If we recognize the signs, we know about them of overimmune reaction in the body, and it's critical for, making sure that we can say, oh, crap, I have that. Did I say that word? Yeah, I said that word, because that's what we're talking about really is crap. So what you got to do is you've got to be able to, one, know where it's coming from, two, what it's going to take to fix it. And it can be fixed. And the drug companies aren't going to tell you it can be fixed, because then they lose money because they can't give you the immune suppressors and the anti-inflammatories and things like that. They don't fix it. They just keep you in that loop where you got to take this stuff forever and forever and a day. You want to change your mind? You want to do something differently? Then join me and Dr. Zhang on the 20th. And I promise you, you're going to go away with some data and how to fix things that you normally wouldn't have considered. But I promise you, if we tell you something and we tell you it's going to work, it'll make a difference. But we need you as our partner. We need you to step up to the plate and do what it needs to do. How about starting this year, going into, when we think immune responses are going to be much more significant, it's called this fall, and going into the winter months and so forth. And wouldn't you like to know how to really put it together and make a difference? I don't know about you, but I'm going to, and I continue to do it on a day-to-day basis. So join us the 20th. Call us, drtomroselle.com or 703-698-7117. We're coming up to the break. I want you to follow me right onto live stream, and make sure you're following me on all the social media platforms so we can let you know when we have something special. Remember, I'm here every Sunday on WMAL for one reason only. I love you all. You have a great day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.